Like, tell us a little bit from your perspective. What are you seeing? What are you seeing? What's the conversation like?
Yeah, so I think, when this first all started back, end of January, beginning of February, when we were first screening people, really screening things for, traveling, working at Biogen, and now it's just become anybody with flu-like symptoms. So I think initially people, were a little bit more, they felt safer because they were like, oh, I didn't travel internationally, I don't know anybody at Biogen, but I think now that we've made people aware that, okay, even if you haven't had those things, if you simply have fever, cough, sore throat, technically you do now meet criteria for COVID testing. So I think it's become, initially, urgent care wise, we slowed down a bit because people definitely were listening to like the social distancing things, staying at home. But now people, are coming up because as more tests get, developed and distributed, I think a lot more people will want to be tested, just not only for their own peace of mind, but for their family's peace of mind to kind of, get on with their life as well. So we've seen, a lot of concerned people, and unfortunately healthcare workers like us, we wish we could tell our patients more, but we're still learning so much about the coronavirus and COVID, and every day things are changing. And I think over the next month things are really, definitely gonna change as we diagnose more people and more tests do become available.
Yeah, don't you think that what I find interesting is I've seen a lot of posts about what this is, what it isn't, what, there's a whole, whether it's a political ploy and all of that, which I think now we know it's not. It's just, it is what it is. But in terms of, learning stuff each day, I think that that's really critical to hear from people like yourselves, that it's not all figured out. And so therefore you don't know. I think the most recent thing that I read was about like younger individuals, that it was like, oh, it's not a big deal. You'll get flu-like symptoms. You'll be fine. It's like, well, now we don't really know that because we're seeing more cases pop up, more folks. And so what have you seen in that dynamic, or,
Yeah, so I think, initially compared to other types of, and they call it like a zoonotic disease. So basically, these diseases start in animals, and then at some point they do get transcribed into becoming a human-like virus. And initially with this one, compared to something like swine flu, which essentially is in that same kind of broad category, swine flu affected a lot of infants and, middle-aged and elderly. And with this, we were just seeing a lot more elderly diagnosed. Now, whether that was because demographics, where things, started in China, the population smoking, initially they said it's more of a male predominance, but then they realized, well, most men smoke in China and probably have lung disease. So we're still seeing, yes, if elderly are being, the most at risk, most affected, but just because you're 30 and healthy doesn't mean that you won't have, bad symptoms. We know that some, if you do have a good immune system, technically you should be better protected than the rest of the population. But still, sometimes this virus, just the way that it transcribes into your own, into your lungs, how much inflammation goes on when that actually happens. It's your immune system against this thing. And yes, if you do have a stronger immune system, you do have a better outcome, but we can't say that just because you're 100% healthy, have no risk factors, anything, that you won't end up, with a critical case of COVID compared to, the rest of the population.
So what does that mean in terms of like social distancing? Because I think that there's been a lot of conversation around that, and like, recently CNN's posted pictures of beaches in Florida being full, and can you talk from a healthcare perspective on what does that mean? And I think that we all have our own kind of viewpoint, like, can we go out and see friends? Should we stay at home? What about going to the grocery store? People touch the groceries, handle that, even the mail. It's like, when does that domino effect kind of stop? And also, how much distance in terms of social distancing, do you need? And would, do the healthcare professionals recommend?
I think, I appreciate especially all of our friends who really, jumped into taking social distancing seriously. I think, it's a tough concept for everyone. You can go to the extremes versus, unfortunately, the people that are on spring break who are not taking it seriously, is a complete, opposite of what we're really hoping for. I think social distancing, yes, you're still gonna have to go outside, go to the grocery store. You're still gonna go out, have to go to CVS. If you're feeling otherwise healthy, by all means go. Now, that being said, if you have a cough, if you have a fever, if you're symptomatic, you really shouldn't be going out to these places and should either find some way to have stuff brought to you, or, really take the quarantine a little bit more serious. As far as people, not having symptoms and feeling otherwise good, yes, I think still going outside, limiting, again, to how many friends you're going to see, still not doing any type of, large group, a few people, yes. I mean, some households, apartments live with like 4 or 5 people. So I think if everyone's feeling well, that's totally fine. But for healthcare workers, I mean, for us, it's tough. I mean, I know I'm not going to see my family probably until middle to end of May, and it sucks. And I know a lot of other healthcare workers are in the same position where, if their husband or wife, works as a nurse or works as a doctor, that, they're sleeping in separate rooms. They're, going as far as sleeping in the garage until a lot of this is over, because we are exposed potentially every single day and can't really do the as strict, 2-week quarantine. So it sucks when you do see people not at least, doing a little bit of social distancing. I mean, some people are going, like you said, going to spring break and completely blowing this thing off. And this, 2-week quarantine thing isn't meant to be forever. But if people just really follow the rules, this is going to be over. This isn't forever. It's not like this is going to extend into the summer. I mean, yes, the COVID virus is going to probably be around for a long time. But if we can just lower the load a little bit, I think it's going to, make outcomes a lot better.
Right. And I think that's what people sometimes forget too, like, especially as young, healthy individuals. It's like, oh, I'll be fine. If I get it, I'll be sick for a few days. But what people don't realize is it's that, one, it's the domino effect that it has for each interaction. And I saw this great post in the Washington Journal about like these dots and how, if you separate, the dots stay on one side. But if you open that up, you start to see the effect that it would have. And then they were also saying, now remove some of those dots because some of those are elderly people where this will be fatal for them.
Right.
And so it's really interesting, one, that domino effect that I don't know that people think about, like, okay, I go and interact with you, and then you go and interact with so-and-so, and they go and interact, like, at some point in time, you're going to hit somebody who might be affected, critically by this. And the other thing too is the burden that it has on you all. I mean, what does the ER and the urgent care look like these days? I'm sure it's just, and how do you separate people? Like, what are you doing?
So right now, with us, because we're trying to take off before, we end up getting testing, because right now we're still waiting. Right now we're trying to take some of the load off some of the hospitals, because as far as we know, and again, this could change, daily, weekly. As far as we know, we haven't had any cases that have tested positive for the flu as well as coronavirus. So what CDC and the WHO are saying is that there is a 1% or less chance that you can have a co-infection with both. So to ease some of the load off the hospitals, what we've been doing is kind of having quarantined like room. They, coming through using a separate entrance, having the, whoever is talking to patients being in full PPE gear, including N95 mask, face shields, everything, gloves, gown. And that room is only for potential patients. So what we're doing is, testing as many people for the flu. If they are negative for the flu, then yes, we do move on to recommend COVID testing. And certain hospitals as well have certain areas where they want patients to enter and exit from if they want to be tested. They have, certain hours that they prefer patients to come in who are otherwise healthy, who simply just want to know if they have it or not, but have symptoms. And as healthcare workers, I know it's probably frustrating as a patient because you want to know. You want to know if you have, COVID. You want to know if you can be around your family members and, get back to your life. But if healthcare workers are asking you, go at this certain time, use this certain entrance. I can't stress that enough that, we've had people who we've, made appointments for, had everything set up and still, step foot into the emergency room. And it's heartbreaking because, you try and explain how important it is that it's not just you, of course you want to know, you want to know your diagnosis, but by not adhering to instructions, and it's very simple, if people just kind of follow the rules, things will get better. But it's all the people that, kind of stray away and then step foot into a doctor's office or a clinic or an emergency room entrance that isn't set up for that. They're exposing everyone. And a lot of people, they do think with COVID actually are asymptomatic. So it could transfer to another person who doesn't have symptoms. And then if they live, with someone elderly, it spirals out pretty quickly.
Right. You just don't know it. You don't turn like that, like the Washington Post. You don't turn a different color when you're affected, know, whether it's, so you may never know. That's so what about like people who are coming in who think, who have these symptoms and want to get tested? They're coming in the separate entrance. Are they coming in with family members? You have to separate the family members. Like, how does that all work?
So recently, in the past few weeks, we've started limiting any kind of visitor. So of course, there's situations where like a parent is bringing their, children, they have to bring the other children. Of course, that's life. But for other people, let's say it's a girlfriend or another family member, even if they don't need to be there, if they're not for a visit themselves, we're not having any additional family members, visitors, anything in the room. And before patients even come through any kind of entrance, they're being screened to say, do you have any of these symptoms? If you do, go back in your car, call us, we'll review all your symptoms and then triage you in. That way, if we can limit them, anybody even getting into the building, it also makes patients who have no symptoms, who, may have broken a bone or just need stitches, it makes them feel safer about coming in and not having to worry about entrance-wise being exposed while they're sitting in the waiting room.
Yeah. So has there been, I've heard a lot of talk about potentially using some of kind of the military strategy, setting up like, hospitals or I don't know how you what the term is, but you would set up kind of another facility and use that as potentially like for the broken bones for that. Has there been talk about doing that here in Boston? I mean, I know that our healthcare system, the infrastructure is pretty sophisticated, but have you heard anything about that? Or
I know a few of my friends have either spouses or family members that are in the military. I know that some of them actually have been activated, like for this everything going on. This, as far as we know, we have heard talk about other facilities possibly being turned into, other kind of centers, either just for COVID patients to take some off of, the load off of the hospital. And for, patients that, because we're going to get to a point where, we need to do some of these surgeries that patients have been put off, especially when they consider like some elective surgeries. Eventually they're putting them off, but some of them, they're elective, but only up to a point. So they know that, within a month, they really are going to have to either turn things around. So I think, I have heard a lot of talk of, other facilities kind of now that, especially since like college students are out and, a lot of businesses are, not in office, talk about transforming, some places to at least take off the burden from the hospital.
What about supplies? Like, what are you seeing? I mean, we hear all this stuff, but like and I know this is just specific to where you work and what you're seeing and what you're hearing, but what do you see?
So supplies is definitely a huge thing. I think, even so, take last year, for example, when there was a big hurricane and IV fluids went on huge shortage. So of course, with everything in the news, people heard about, needing, use a mask, protect yourself, hand sanitizer, all that stuff. And people, of course, kind of take that in a panic, and, you know, whether they bought all the supplies online or, you know, people unfortunately stole from buildings and from hospital centers. The thing that I think a lot of the public doesn't know is that, so an N95 respirator mask, N95s can be reused. Healthcare workers do reuse them until they get completely soiled by, you know, whatever. You can use them for days on end. Surgical masks, or N95 masks, essentially are like the thicker ones, but most people don't know that you actually have to undergo fitting for them. So you get tested with a bunch of different sizes. You essentially go in like a hooded area where you're asked if you can like taste anything. So a lot of the public that I see who, you know, wearing these N95 masks don't realize that they probably aren't even the proper fit for them. And if they're not the proper fit, you're not protecting yourself. So it's frustrating to know that even some of my colleagues, I mean, we have, you know, extremely limited sizes. I think they could probably scrounge up one other N95 mask for me if I lost one, but right now everything's on such back order. And to hear, you know, hospitals in Boston that they don't have enough supplies for healthcare workers, it's heartbreaking because, you know, for us, we're going in either way. And I mean, that's,
yep.
I don't regret my job for a second. Like, this is, you know, what I signed up for and what I want to do. But not being able to help people or being worried about, you know, the people that I'm helping, you know, because I still need to protect myself. It's frustrating. I will say it is really frustrating to know that, you know, something that healthcare workers need to protect themselves, we can't get because the rest of the public panicked and, you know, is wearing masks that might not even protect them. So it's tough supply wise. I mean, we're definitely, you know, being more conscious about things that we use, you know, washing our hands constantly, you know, and trying to limit our use of things like even hand sanitizer that we can't get in stock. So it's tough to know that you know, you feel bad that people also can't get things like hand sanitizer, but it's the stressing, you know, the not overbuying for simply yourself, understanding, you know, not to be selfish in these times. And you don't need, you know, 12 bottles of hand sanitizer. Like, there was the guy on the news that, you know, bought however many hand sanitizers and then was trying to sell them. Like, it's just, it's sad to see that people are acting that way when, you know, if we just come together and really work together, you know, this can be over with or contained or at least improved upon. But right now I think we're still in like such an unknown time. And like I said, things are changing every day and we really don't know where we're going to be in a week. I think we'll know more information if anything. But it's tough being in like a big limbo.
Yeah, it's like the good and the bad, you know, when it comes to like the N95 respirator mask and even masks in general. It's like if people who are healthy are taking those away from folks like yourself and your colleagues, you know, slowly you all are going to start getting sick and being out, and then we're going to have less and an even bigger burden on our healthcare system because we can't treat them, you know. And I've heard them talking about like military doctors and nurses, but it's like most of those military doctors and nurses are doctor and nurses somewhere else. So it's like, you've only got so many people, and once you start depleting them of the necessary tools that they need to do their jobs and take care of us, you know, we're not doing ourselves any favor, I would imagine. And so that's a really good point. And I think that a lot of people don't know about the mask and the fitting. And I know that there's been back and forth about whether or not the mask even like help prevent it, you know, that you should only be wearing it if you're sick or if you're in contact with somebody who's sick. I mean, have they changed that? Is that still the same kind of logic behind using a mask?
Yeah, so one of like the big things too is I think like DPH and the CDC kind of came up with some criteria as far as, because they know healthcare workers are going to be continuously exposed. But the thing is, you know, just because we're exposed, we can't quarantine because we're probably exposed, you know, every single day. So right now what their kind of protocol is, certainly anybody with symptoms patient-wise should be wearing just like the basic surgical mask, you know, the flat front ear hole each side. If the patient is wearing a mask, it reduces respiratory droplets dramatically to the point where if we're wearing a mask, they're wearing a mask, we get exposed, with every single patient during the day. If we see 20 patients in the day, as long as we don't get symptoms, we don't have to be tested. Just because of how much, just by the patient wearing a mask as well as us wearing a mask, it's hugely preventative against transmission. And I think, they realize that for healthcare workers, because we're not going to be able to quarantine, that the best we can do is protect ourselves and have the patients, protect themselves as well. And that alone can really kind of reduce transmission. So they have changed as far as initially they were saying, if you get exposed, healthcare workers should quarantine, but I think they realized, oh, geez, they're going to get exposed every day. So rather than have people, panic and have healthcare workers out for 2 weeks, just as long as you're masked and you're asymptomatic, you can still carry on your job.
Right. What, and this was a question that came from Jordan. Thank you. What is the, kind of the status on the ventilators? Like I've heard that I heard a construction company that found a bunch of ventilators from, previous work that they were doing in mask, and they sent them over to the hospital. I think it was in Philadelphia or somewhere nearby. But I know that there's a limitation on ventilators.
Yeah, there definitely is. I think sometimes, that America almost takes advantage for, how great our healthcare system is, how abundant our healthcare system is. But at the end of the day, there really is so, we have a limit to things. And, people say, oh, well, I'll buy masks, but they can just make more. Or, oh, there's enough ventilators out, there's enough things out there. There isn't. Things take time to make, things run out. And yes, there is a certain limitation on ventilators, and we're not there yet, but I think people need to be conscious of the fact that there's limits, and there's only so many of things, and there's only so many healthcare workers, there's only so many people that can intubate you correctly, and that if we don't take this seriously, and at least, like I said, at least try with the social distancing, at least trying with doing our part, stay away from the elderly, that there is a chance that, yes, sometimes we're not going to have enough supplies for people. I mean, the ventilator thing is, as well as in other countries too, it's a limitation. And like I said, right now we're not there yet, but I think it is something people have to have, in the back of their mind, that there's only so much supplies out there for everyone to take advantage of.
Well, and it goes back to the fact that, like, if we don't social distance and practice this for a short period, we're going to extend the period of time that we need to continue this, and we're going to expose more people and then put more of a burden on you all. And so, I mean, it's good to hear that we're not there yet, but we look at what's happening in Italy, and, we don't want to get there. So if we can avoid that and stay on our couch for a little bit, a week, and then check things out and see, and maybe it's longer than a week, but if we don't do it now, we're going to continue to have these issues. What, in terms of people living, I know that I've had a lot of people in the yoga community that, as we were talking about teaching yoga during this time, and they eventually shut gyms and studios down, which I think is great, but in terms of folks that are living with somebody who's elderly or got respiratory issues, like my mom's got asthma, is that something, she lives in Wisconsin, so we're not going to be seeing each other anytime soon, but, what are those kind of concerns and considerations with people who've got either, some sort of symptom like asthma, or who are just older and more susceptible to this?
Yeah, I think the concern is definitely there. I think from the get-go, I've been telling kind of every patient the best thing you can do, regardless of if you have symptoms or if you're completely asymptomatic, is to, if someone's immunocompromised, if someone has respiratory issues, if someone's elderly, just limit any kind of exposure that you can have. And I think, people are concerned, especially if you are living with, someone who's elderly or someone who's immunocompromised, really kind of limiting spaces in the house to the point, where using a separate bathroom, if that's something that you can abide to, keeping your distance with people, not, as simple as like not sharing utensils, using, disposable things, washing your hands as much as humanly possible. I think people just have to be really conscious about, those who do have any kind of respiratory problems or any type of immunocompromise. I mean, yes, it can affect, very healthy people, but if you're immunocompromised, I'm sure, hearing a lot of this stuff can make it a lot scarier.
Yeah.
Especially when people don't take some of the social distancing seriously because they don't necessarily, they think, oh, okay, I don't have anybody in my family who's immunocompromised or elderly. But by, going out to the supermarket, if you have a cough and you have a fever and you could have coronavirus, you could affect other people. So it's just really kind of, I can't stress it enough that limiting exposure to people who are immunocompromised, if you're immunocompromised, taking as much precautions as you possibly can to limit your exposure to other people and keeping yourself healthy is so important.
Yeah, I think that's really interesting. I know that like my habits have even changed, where, it's wiping down my computers and like my desk area every morning that I'm waking up and just getting a clean kind of sweep of things. And it's little things that I never kind of thought of before. And I was like, like I'm healthy.
Right.
I'll build up my immunity if I get it. And now I'm like, I don't really want to because, the other thing is, they've been talking and I don't know how much or, can comment on this, but we don't know what the long-term effects of this are. So even if you are healthy and younger, what does that mean years down the line? I've been talking to people and it's like, is it going to be like chicken pox where all of a sudden it reactivates later as shingles? And nobody wants that.
Right. And I think, compared to some of the other viruses or some things that we're, reading today, the inflammation that it has on the lungs, there's definitely a potential that it could have long-term effects. And of course, we won't know that until years down the road. Right. But certainly, we know that the extent of the inflammation that it does have, they're saying right now that critical wise, and this is the reason also kind of why they're doing this 2-week quarantine, but they know that kind of the mean average to when you're exposed to when you're having symptoms is about 5 to 6 days. That being said, they have seen cases extending up to like 10 days after someone's been exposed, then presenting with symptoms. But, if by 14 days, if you've really been taking this self-quarantine seriously, if you were exposed on day 1, by day 14, if you have COVID, technically you should have some type of symptom by then. They're saying like critical illness wise usually comes around the 2nd week. So if people are diagnosed with COVID and symptoms tend to get more severe, it's not necessarily like the flu where people feel horrible the first, couple of days and things kind of get worse pretty quickly. They did say with COVID that the critical wise, you can feel terrible for about a week, but you can still end up, very severely ill even 10 days after from your initial diagnosis. So we know that, there going to be some long-term, effect on the lungs? That's definitely possible. I think with inflammation, a lot of times we'll see, even I see in adults if they've had terrible pneumonia when they were a kid, that they now have adult onset asthma where, and they end up with other types of things that compromises their immune system just by the inflammation that happens from these types of illnesses. The only thing I know that right now that stands, even despite inflammation, is clinical providers that, we're not doing anything right now to treat inflammation of COVID. They are testing certain types of antivirals on COVID, but right now the side effects, like the effect on your liver, isn't great. So we're really kind of limited as far as like what we can actually do medication wise.
Yeah, I know that there is, I saw some articles about a drug that was kind of making its way back into the scenes and having some potential, benefits to treating patients who are diagnosed with COVID-19. But again, to your point, there's so many unknowns and, based on clinical research that they've done with the drug prior, that some of these adverse events are going to occur. And so it's, at what point do you make that decision to treat versus, so it's got to be at the healthcare provider's discretion on how bad is it? How much do they actually need this versus kind of waiting it out.
Right, and I know they're trying to get that drug. I can't think of it offhand. I know it begins with an R, but it does kind of.
I'm not even going to try and pronounce it. I know it's Gilead.
Yes, yeah. So they know that it kind of acutely raises your liver function test, but they said that they're actually trying to get it approved because they know that it doesn't have any long-term effects on the liver. But even doing that, it's such a process right now because of the side effects. They really can't use it until Gilead approves it and accepts that, okay, this is kind of a temporary bump on your liver, but if the benefit of using it outweighs the risk that there could be, a little bit of inflammation in the liver, then they're just trying something.
Yeah. Well, and that's the same, I assume, there's all these companies out there that are working on vaccines and whatnot for it. I don't know what the current count is for some of these pharma and biotechs. I know, there's quite a handful of them that are based here in the New England area. But I mean, even then, what are they saying to you all? You're not looking until, next year to get those vaccinations in place and ramped up to be able to vaccinate people. I mean, nothing's going to happen overnight.
No, I think realistically, I think that's honestly the best way to look at it is that, yes, there are people being tested. I think it's either Oregon or Washington State or where some of the first people are being, healthy individuals, are being tested with the vaccine first because the FDA kind of did a quicker push. But then, just because it works on healthy individuals, they do have to test it on non-healthy individuals, which people don't always realize. And then after your testing, of course, you have to see if it actually even worked. So I think the realistic outlook of it is probably, 12 months or more before we see anything actually on the market for vaccine. And even then, I think it's going to continue to change yearly. I mean, you see the flu vaccine change yearly, just by how things trend. I think, that's probably the most realistic outlook for it is probably not till next year that we're going to actually see anything publicly on the market.
And that's unfortunately just the process. I mean, they do speed it up. The FDA is doing compassionate use for Gilead's drug, but at the same time, it's, you've got to think about the patients and you can't just give them something without knowing the side effects, and they're trying to go as quickly as they can without putting the patients at risk. So what about in terms of the tests that are being issued? I know that there are some, we've talked about this. There's some validated tests that have been used for different viral infections that have been, approved by the FDA to go to you all to test these patients. Where are you in terms of the quantity to be able to test, the amount of tests you have, and then how long does it take right now? I mean, these aren't rapid tests, right? These are 3 days or
yeah. So right now, I mean, I know a few companies like we talked before have kind of said, okay, one-day testings are going to become available, but they're not currently available. So what we're using is like a 3-day test. So someone gets tested and then 72 hours later you get that result. I mean, the flu has been around forever, so it's evolved to like a 15-minute rapid test. It's the sensitivity and specificity is actually really great, but right now the COVID testing, I mean, it's the 3-day test is pretty accurate, but still it's a tough kind of waiting period because it's that person, of course, is waiting for 3 days. Whoever they're exposed to is waiting for 3 days. And it used to be, the CDC, because we didn't have much testing, that there really was some strict guidelines on who actually can get tested, which they more recently lifted. But still, I mean, there's right now the amount of 3-day testing, we're not abundant with it. I think we're really kind of hoping that these 1-day tests do come out sooner so that we can actually, offer these to people, because we want to test people as much as people want to get tested. We want to make people aware, of where they stand. But right now, it's just we really don't have that resource yet.
Right. Well, and I'm sure then it becomes a numbers game too. It's like, right now we get so nervous because we hear that numerator on how many fatalities we've had because of this, but we really don't know the denominator underneath it because we haven't been able to issue these tests and test everyone. So there's a level of, diminishing that fear and that anxiety by knowing that there's many
Yes.
more people that may be asymptomatic and again be fine. But there's also, you know, that worry that the more the numbers increase, the more people get more anxious about it. So
Right. And I've been trying to stress to a lot of people, and, you know, some people get scared by it, and it's not meant to scare anyone, but I tell everyone now, you know, assume you've been exposed, number one. But two, that, you know, you hear in the news, and the news skews a lot of things, but the news, even the other day, was saying, you know, there's going to be a large increase in diagnosis of COVID. Well, yes, but that's also, you know, underlying all these companies that are coming out with testing. So
yeah,
there are going to be more diagnosis, but I think once the big picture comes out, you know, to how many people are diagnosed, to how many fatalities. I mean, yes, right now we speculate that COVID is more deadly than the flu. But again, we say that based off the numbers that we have, and we haven't had enough clinical data to really make an accurate, you know, mortality rate. The last numbers that I saw, I think were like 1 or 2 days ago. Then we had about, I think, like 7,000-ish diagnosed in the U.S., and I think we had about 110, 115 deaths in the U.S., where worldwide diagnosis, I think there were more about like 150,000, with like 8,000 deaths worldwide. But still, every, you know, back in, you know, a week before that, you know, we only had 40 in the U.S. So it continuously changes. And I think until we have, truthfully, like 3 to 4 months of data, I think you can't really make an accurate, you know, mortality rate until we start diagnosing people.
Right. And making the assumption, I mean, you know, I think going back to your earlier statement of, you know, assume that you've been exposed, assume that you may expose somebody else to it, and keeping that in mind, you know, yes, the fatalities have happened more in the elderly population, but it doesn't mean that they're not happening. I mean, I read the other day that a, you know, 53-year-old, and I don't know any, you know, conditions that he had prior to being tested and testing positive for it, but you know, it can happen. And so it's like, you know, be precautious, take notice of what is being advised from healthcare professionals like yourself, the CDC, the WHO. You know, they're bringing out this as much objective information that they can based on the information they're getting, which is, you know, increasing every day. But so I guess, you know, kind of wrapping it up, you know, what would be kind of like your, you know, takeaways from the fact, like, if anybody who's listening to this who, you know, has children, has teenagers that are, you know, itching to get out, has elderly family, you know, social distancing, wash your hands, you know, if you feel sick, go and get tested. I mean, what would you recommend for people as kind of their things to consider as we go through the next week or two of this quarantine?
Sure. I think my biggest things are that, you know, we do all need to work together, and we need to be humble about this. I mean, no one wants to be, you know, self-quarantining at home. Everybody's getting restless, yes, but and I understand. I mean, I can't imagine, I still go to work, you know, during the week. I can't imagine being, you know, at home trying to do work, and it's a whole different lifestyle they have, you know, you have to accept. But like I said, this isn't forever. And if you take it, you know, the quicker you take it seriously, the quicker that we can move on with a lot of things. But the lag and the fact that people aren't taking it seriously only means that we're just going to have to push this further. And no one wants to push this quarantine further. You know, that the fact that 10 more tests are coming out, I do want people to be proactive, you know, if they think, you know, they have symptoms. Not, you know, if you've been exposed, you have to rush to go get testing, because it doesn't necessarily mean you will get it. But certainly if you have a new drier cough, because the cough with COVID doesn't start like a thicker cough, it's much more of a dry cough. If you feel feverish, you know, it is worth to call your doctor. You know, we're stressing right now, don't just show up somewhere. If you think you've been exposed or you have symptoms, call your primary care office, call your local emergency room, call an urgent care to, number one, not only see if they have testing, because a lot of places still don't, but number two, to see kind of what their protocol is. The best thing that you can do for yourself and for others, because you know, if someone has it and you don't, the last thing you want to do is get exposed just by not following protocol, is just to kind of call and figure out what your next steps are. I mean, DPH is 24-hour hotline, and they'll tell you too, as well as like where you can get tested, where local sites are doing testing, so that, you know, at least people can kind of know what their next steps are. But just to kind of be proactive with this, the sooner that we, you know, adapt a bit of a different lifestyle, the sooner that we can all move on from this, and, you know, to allow healthcare workers to do what we need to do. And, you know, like I said, be humble. Don't, you know, be buying 1 million hand sanitizers, because at the end of the day, we still need it too. And just to, you know, be mindful with this whole thing. It isn't forever, and the quarantine is simply just trying to make a difference in lowering numbers. And it's the most that you can do right now.
Yeah, I think that's great. And I think, you know, the idea of being humble and being kind to people, I know I've been thinking a lot about that. It's like, you have no idea, you know, who's going into the hospital day in and day out and being exposed to this. You have no idea who's losing a job right now because bars and restaurants and, you know, hospitality businesses that rely on people coming in aren't open anymore. So keeping that in mind, yeah. Well,
and I feel for,
yeah, I do too. I know, I mean, I've had, my sister's boyfriend is, you know, out of work right now, and just, it's like, and, you know, eventually he'll get back, but it's like,
of course.
I mean, they've told my mother, she works at a surgery center, and so I'm waiting for her to say, oh, I have to go into the hospital because they need more staff in the ER. But the surgery center, it's all elective. So she's like, today's my last day, and I don't know when we're, so it's all these interesting things that you don't think about. But, you know, thinking about what somebody else might be going through or how it might impact somebody else, and being kind and being humble. Yeah. Well, awesome. Well, thanks for joining. Thanks everyone for coming in and listening.
Of course.
I hope that come May we can see each other and have a glass of wine.
Yes,
so
absolutely.
Hopefully, if everyone just stays put for a little bit longer, we can all have our girls' nights again. So
I agree.
All right. Well, stay safe, Christine.
I will
Talk
do.
soon.
Thank you. Bye.
Bye.